Great. Well, good
Well,
noon, everyone.
oh,
And
sorry, Dr.
that's all
Slusser.
right. Sure.
I just wanted to actually just welcome everybody really quick to
Okay.
our Continuing the Conversation webinar. This is our final one for the school year. So thank you very much to everyone who's been coming to our webinars, and for those of you first timers joining us today, thank you. This is our monthly lunchtime webinar, and we are very fortunate today to hear from Dr. Wendy Slusser, Associate Vice Provost of the UCLA Healthy Campus Initiative and HS Clinical Professor in the Schools of Medicine and Public Health here at UCLA. Dr. Slusser will discuss childhood obesity and the ways we can cultivate healthy eating habits through childhood and adolescence and into adulthood. She will also explore how to eat healthfully and sustainably for our health and enjoyment as well as our community. We're going to save a few minutes afterwards for questions. If you come up with questions during the webinar, please feel free to write it into the chat window below your name. If you write it in the chat window, I'll add it to the queue and we can put it as part of the Q&A session at the end. So Dr. Slusser, I'm so sorry for interrupting you, but go ahead and take it away.
No, absolutely. Thank you for that nice introduction, and good noon to everyone, and thank you for including me in this last webinar series, which has been awesome. I've seen a number of them. I'd like to recite the name of the title of this talk, which is Raising a Healthy Child, Tips for Healthy Eating and Physical Activity. And we have a variety of learning objectives. One is to identify 3 strategies to promote healthy eating and physical activity among infants, children, adolescents, and families. And the second learning objective is to identify 3 community strategies to promote healthy eating and physical activity among infants, children, and adolescents and families. And I noticed that we have a small group today, so if anyone has questions during this talk, please feel to type them up and I'll try to address them during the talk. Most of us know that there's been a huge rise in childhood obesity. This is the data since the 60s, nicely since 2007. You can see there's been somewhat of a plateau. And even better news is that the 2 to 5-year-olds that have been reported in the last year's set of data from CDC show that there's been a nice downward turn among all the children between the ages of 2 to 5. And then if you actually look at some of the subgroups among the non-Hispanic whites and then the non-Hispanic blacks, you see even a larger precipitous drop. Very encouraging. So most of us are always sort of shaking our head going, why? And of course, is it larger portion sizes? Is it poor routines? Is it less family meals? Is it lack of early detection? Is it low exclusive breastfeeding rates? Or is it all of the above? Well, it's all of the above. And when I was training as a pediatric resident 30 years ago, when I drank a coffee, it would be with whole milk. I often didn't include the sugar. But today, our residents and others are drinking mocha coffee, often with steamed whole milk and mocha syrup. And what's the difference in calories? Well, if you look at the coffee 30 years ago, it was about a 45-calorie 8-ounce in the coffee portion. And now, what do you have? We have 350 calories, and usually it's twice the size. What would that take for us to actually make that difference of the 305 calories between the 2 different coffees? Well, it would take us 83 minutes of walking, or 45 minutes of cycling, or 34 minutes of jogging, or 25 minutes of swimming. And my dad often says the best form of exercise is self-control. But we know that's hard sometimes, and certainly for children. And what do we have to do? What is the risk of an overweight child becoming an overweight adult? Well, is it 10 to 30%, 30 to 70%, 80%, 90%? Actually, it's 30 to 70%. And the reason there's such a wide range is that if you're an overweight younger child, but then grow out of it, you're going to be more likely to be a healthy weight as you grow into adulthood, versus if you're an overweight or obese adolescent, your chances of being an overweight or obese adult is much more likely. And why are we so worried about overweight and obesity? Well, it's because of all these comorbidities that we have to contend with if you have a higher weight. And these are the lists that children who are overweight or obese are afflicted with. Non-insulin dependent diabetes sometimes, gallbladder disease. Many of these things, as we know, are adult usually adult onset like comorbidities, but these days we're seeing them in pediatrics. In fact, in our pediatric residency program, we've had to start teaching how to manage these kinds of adult-like diseases when in the past, when I was training, we never had to deal with them. But interestingly, if you were to actually sort of rate which comorbidities are driving costs for the children who are obese or overweight, you aren't seeing it in the non-insulin dependent diabetic, sleep apnea, or asthmatic categories. It's actually the mental disorders, musculoskeletal, and GI complaints. These are what are driving up the costs for the childhood obese child population. And so let's get to the solutions. So there was a really nice summary of what pediatrics and other primary care providers could do in terms of primary and secondary prevention of childhood obesity. And they reviewed the literature and published it in 2007 in a supplement, Pediatrics, in December. And in that supplement, they identified what would be the biggest bang for the buck, what is the strongest evidence that could help prevent and also minimize pediatric obesity. And if you were to make a list of what was the most effective, it is minimizing sugar-sweetened beverages with a goal of 0. This is the list that has the strongest evidence that shows how you can minimize or prevent childhood obesity. Sugar-sweetened beverages is one very strong piece of evidence to minimize to 0. Others are more sort of behavioral, like meals prepared at home, or education modification of portion sizes, reduction of inactive time to less than 2 hours per day. And if you're less than 2 years old, you're supposed to have no inactive time. Increasing active time for children and families to greater than 1 hour per day. And of course, while you're doing that, you always have to include the whole family, and you have to be culturally sensitive. This is a list of evidence that could work for some people, not everyone necessarily, but certainly can be helpful and certainly healthful. And that includes increasing your fruit to 5 and your vegetables to 5 servings or more, reducing 100% fruit juices to what we recommend to children at 4 ounces or less, consuming a healthy breakfast, reducing foods that are high in energy density, meal frequency and snacking. And then of course, when you're doing this, always consider the whole family and being culturally sensitive. So how do you remember all this? Well, when I talk to parents, I use a modification of a social marketing campaign that's been used quite frequently in parts of the East Coast and has been adopted by the American Academy of Pediatrics. It's the 5210. I've modified it to include a breastfeeding message, so it's now 5210 blast off. And that means 5 or more fruits and vegetables per day, no more than 2 hours of screen time per day for 2-year-olds and none under 2, 1 year or more of breastfeeding with appropriate foods introduced at around 6 months, 0 sweetened beverages, and blast off, move, be active, and have fun. So how do you deliver this message to parents or families or healthcare providers? Because, yeah, people know the information. They know, yeah, I get it. I have to eat more fruits and vegetables. I have to get my children to eat more fruits and vegetables, but how do you do it? So the evidence in terms of strategies to improve fruits and vegetables have been shown to increase basically availability and accessibility of fruits and vegetables, which would mean really translated to healthy choices at school, home, team sporting events, and then also modeling healthy eating behaviors. Practicing eating family meals, for instance, is a very effective way. And there was a really nice study that showed how effective it was among adolescents who were eating at least 7 times per day. They were eating up to 4 fruits and vegetables per day, whereas those adolescents who never ate at home were eating less than 3 fruits and vegetables per day. Clearly, eating at home also has very much protective factors for other challenges that adolescents might be encountering in families. Also, salad bars in schools increase availability and accessibility. And my colleagues here at School of Public Health, we did a study that looked at pre-salad bar intervention in a group of schools and post, and we were able to show that the frequency of fruits and vegetables went up significantly in the post-intervention lunch period when we had salad bars available to those those students. That was a pilot that was 3 schools, and there were predominantly Latino and African American children in those schools in LA Unified. So what do you do about TV? Well, if your goal is no more than 2 hours of television per day and none for the less than 2-year-olds, why don't you choose a time for the family to watch a show, and then they plan on it. They basically plan the shows they want to watch so that they're only going to be watching 1 to 2 hours for the day, and they turn the TV off once the show's done, so they're not rolling into the next show, and that might create battles with the child, like, oh, I want to watch the ending of this story, or so forth. If you just use a timer, if you're not watching it with the child, and you know when the show ends, and then you turn it off. Also, removing your television or computer from a child's bedroom is key. It's been shown to reduce television viewing by 15 minutes a day, which obviously over time can accumulate to quite a bit of time. And this is the AAP recommendation, as I mentioned. 0 to 2-year-olds should not be watching any TV or any screen time, and over 2-year-olds should not be watching more than 2 hours. Okay, so another question. What can you do to support social justice and prevent obesity? Is it promoting breastfeeding, reducing alcohol consumption, reducing cigarette smoking, or promote gum chewing? Well, it is breastfeeding. So if you can support women who live in poverty to breastfeed, it provides equal opportunities for infants to grow and develop optimally. And there are some key points in which you can promote breastfeeding if you're a healthcare provider, or if you're an employer, or if you're just a family member. It's during pregnancy, newborn period, 3 to 5 days of age, 1 month, and then when the mom's going back to work. These are all sort of sensitive periods that can make a huge difference in terms of success for a mother to reach their breastfeeding goals, which might differ among different people, but the goal for anyone is to be able to reach what they want to reach. And the reason we mention it in an obesity prevention conversation is that if you look at the data, you can reduce obesity by 24% if you optimally breastfeed. And optimally means 6 months of exclusive breastfeeding with introduction of appropriate foods at 6 months with continued breastfeeding for a year or more. And many people wonder why. There are some studies that have evaluated this. These are still not completely confirmed, but there are suggestions that because infants self-regulate at the breast, this might be the reason, or it might be that there are different feeding patterns and maternal behaviors around breastfeeding. It might be that there's early growth acceleration that's reduced, and that might reduce the risk. It also might be related to some of these hormones that regulate appetite, leptin, ghrelin, and adiponectin. But we do know that for every month of breastfeeding, there's a reduction of risk of obesity for children by 4%. And I talked to my friend Larry Grummerstrawn, who at the time was Chief Nutrition Branch at CDC, and he said basically that the evidence for the association is nearly all epidemiologic, so it's difficult to tease out true causality. But epidemiologic criteria that includes temporality, dose-response effects, and reasonably good consistency of findings makes it a strong confirmation that breastfeeding does protect against obesity. Now, we don't know, though, about the biological explanation, so there's more to research. Okay, so how can hospitals and employers save money, reduce hospital infection rates, reduce disparities, and attract new patients and employees? The answer is create a baby-friendly atmosphere. And Baby-Friendly Hospital kicked off in the early 90s, and now in the United States there are over 220 baby-friendly hospitals, of which the large majority are here in California. There are also things that are called baby-friendly workplaces and baby-friendly daycare sites. All of these help support an environment to support women to breastfeed or families to continue to breastfeed. And here's an example of a baby-friendly workplace. You set up a lactation room, you have a sink, you have a nice place where the mom can pump if she doesn't have access to her infant, and you also have a door that you can lock so you can feel safe when you do the pumping. Okay, so here we are, 52105 5 or more fruits and vegetables, no more than 2 hours of television if you're over 2, none under 2, 1 year or more of breastfeeding, and zero sweetened drinks. And then also included in this, we include the education and modification of portion sizes. And so really the goal is not to have any soda in the home, and not necessarily limit it or create sort of a forbidden food for children outside the home, but just not have it in the home. That's the way to increase access and availability of healthy foods and decrease the access of unhealthy foods. Limit juice to ½ a cup per day. Reduce milk to 1% fat after 2 years of age. Limit high-fat food. And reviewing portion sizes. And the best way, of course, for portion sizes is using the My Plate. It's a great method to deliver what kind of proportionality you'd like to see of the vegetable, the fruit, the grain, and the protein on a plate. And then the dairy is a separate one. The idea is that you want to make sure the child knows, or the parent knows, that the plate is a different size for the child versus the parent, and you use the child's fist to show how much vegetable, how much fruit, and how much grain they might need, and the child's palm to show how much protein, and that would determine the size of the plate. And then I often have the parent look at their own fist and compare it to their child's to show how different it is compared to theirs in terms of portion. And over time, I've also been very respectful of snacks. Snacks in our tertiary clinic, where we treat morbidly obese patients with an interdisciplinary team of a dietitian, a psychologist, and a trained general pediatrician who focuses on this field, we often will tell parents and children who are morbidly obese they need to introduce a snack because that actually has some great value. And the kinds of combinations of snacks are things where you add some sort of fruit with a kind of dairy or kind of protein-like food, so veggie or protein, and of course dairy and grain, that's another nice snack. And of course the size is going to be a little different than a regular meal. So what can you do that is fun, makes you feel good, improves your health, and makes you look younger and is free? Exercise. So what can you do about exercise? If your goal is 1 hour or more, you want to include, though, aerobic, muscle strengthening, and bone strengthening, very important. And you want to be a role model if you're a parent or a family member, and you want to make exercise fun and also sort of put interstitial exercise into your daily life, like what we're doing here. The Be Well pod that's part of the Healthy Campus Initiative is putting prompts all over campus, helping to support those that can take the stairs to why not take the stairs instead of the elevator. And here's an example of a prompt. What are you waiting for? And showing people that can access the stairs instead of the elevator. All in all, though, remember we're talking about cultural sensitivity, openness, very important when you're counseling people about healthy lifestyles, that you use open-ended questions, and you also recognize that it takes skills other than just the messages and the education. You need to teach parents, for instance, how to give commands, how to set up routines, and how to give praise. And we actually have just developed a nice toolkit in conjunction with the LA Department of Public Health that will be available in June for anyone to use, that has a nice 6-week intervention that has been evidence-based, studied by us here at UCLA, that shows that you can actually develop parenting skills integrated with nutrition and physical activity messaging that will, after 1 year with parents with 2 to 5-year-olds, can reduce the upward trends that we were seeing in our clinics in the community in terms of weight gain. So if we optimally raise our child with or deliver messages that are going to support healthy eating and healthful lifestyles, starting prenatally or even before, and then during infancy, toddlerhood, preschool age, elementary, and high school, versus the compromised way of living, so to speak, you're going to see an improvement in the outcomes of the child's weight outcomes, or BMI, percentiles, compared to those that practice less healthful behaviors. And of course, if they hit this age, 15 to 18, with a BMI of over 30, clearly they're entering their adulthood already obese. And that's why we want to support this whole concept of wellness for life. We have to think of promoting health and wellness through the life trajectory. But we know motivation is hard. I want a fitness video, do you deliver? So how do we do it in a way that potentially doesn't increase individual effort, but we're increasing population impact? If you look at Frieden, Dr. Frieden's his health pyramid, health impact pyramid, and if you look at the biggest health impact is really related to socioeconomic factors. On the next tier is changing the context to make the individual's default decisions healthy. And as you move up, it becomes more and more the individual that has to make the effort, with counseling and education being at the top. I'm not saying that any of these are less important, though. They're all important. And if you look at the McKinsey report that came out in 2014 that analyzed the Great Britain's situation related to obesity, they have shown that we need to be working at all these levels in order to reverse the obesity epidemic. And if we don't try innovative interventions that might not have even been well studied at this time, we still need to do it. We're losing time, because by 2030, 50% of our population in the world is projected to be obese. So we cannot wait, and certainly we cannot wait for the children, because they are our future. So what have we done here at UCLA through the Healthy Campus Initiative is that we've actually been working on this level, primarily changing the context to make the individual's default decisions healthy. And we've been working on active transport. We've been working on price promotions. We've been working on healthy meals. We've been working on portion control. And we've also been working on reducing the availability of high-calorie food beverage availability. We've also, though, of course, because we are a campus with a hospital, we've been working a lot on counseling and education and clinical interventions and long-lasting protective interventions. So we've been working on all these different tiers. And if you think about it, we also are working on the socioeconomic factors, considering we have 35,000 students that are going to come through our doors. And of course, when you graduate with a college education, you're much more likely to have a higher earning power that can help support a healthful living. This Healthy Campus Initiative was envisioned and supported by Jane and Terry Semel. 3 years ago, we launched it. And Chancellor Block is behind the effort, and he basically said, in order to take care of the earth, we must take care of ourselves. When we went smoke-free, which was on Earth Day over 2 years ago. And the core values of the Healthy Campus Initiative are the following. It's high-level wellness, personal responsibility, diversity, equity, and it's integrative. And we are focusing on the students, staff, and faculty on our campus to make the healthy choice the easy choice. But we also recognize that friends and family, coworkers, friends, neighbors, family, all are important. Also, the community and neighborhood are critical. Deans, healthcare providers, professors, farmers, and then organizations and institutions like the media, law, popular culture. We take all of that into account. And we've created 5 pods, of which the original 4 were Move Well, focusing on physical activity, Eat Well, focusing on food, Mind Well, emotional well-being, and Be Well, the built environment. We've embraced Breathe Well as one of our 5th pods, which is the tobacco-free environment. And then we've also caught on to the entire UC campus, UC campuses across California, and now we have what we call the UCLA Food Initiative that has now been embraced by the UC Office of the President, that's now called the Global Food Initiative. And here on campus, we've created gardens that have been part of the Be Well and the Food Well or Eat Well pods, where we've planted medicinal gardens south of the UCLA hospital system at Ronald Reagan. We've also created intervention at our vending machines, and we had a very fine, talented school of public health grad student evaluate how do you change behavior at the vending machines in purchasing healthier items. And what he did was he used behavioral economics in collaboration with our housing and hospitality and put at eye level the healthier items in 1 or 2 rows and less healthy items in the machine, but put them sort of lower. And he also changed the prices, reduced the price of the healthier items, and increased the prices of the less healthy items. And he looked at the price, looked at the earnings of those vending machines and how much were sold. And he also evaluated who came to the vending machines and what they bought. And he found that the vending machines that had the intervention increased their sales of the healthier items when they were at eye level, and they also did not lose any money. And he also found that 60% of people who go to vending machines don't have any idea what they're going to buy. And if they went to the intervention vending machines, they were much more likely to buy the healthier items. So we were able to significantly increase the purchasing of healthier items in the individuals who didn't know what they were going to buy in the first place. So it was a very successful intervention and study, and we've continued to have this kind of presentation of what we call behavioral economics in terms of influencing people to make the healthy choice the easy choice without them even thinking about it. Also, there was a new dining hall that was opened over a year ago on campus for undergraduates called Brew and Plate. And as you can see, it has beautiful it has beautiful images of the medicinal herbs that come from our medical library collection of rare book collection. And also they have painted beautiful colors on the walls to create an environment not just where you would get healthy food served to you, but also you would have a sense of health and well-being while you're eating. And the music that's piped in also has themes such as those that would help create a mood that would make you have a more mindful kind of eating process. And then of course the food itself is beautiful, as you can see, and they spent an entire year developing these recipes with input from the undergrads. And I have to say, we take our guests, whoever shows up on campus whenever we can, to the Brew and Plate to show off what an amazing place an undergraduate dining hall can be. Certainly not reminiscent of my dining hall 30 years ago. Also have to, the Brew and Plate also took a bold step and has no commercial soda served. And there's literally an hour wait for undergrads to come in and eat at dinner time. And I think that's just a testimony to what undergrads are looking for, which is a healthful way to eat. And if you provide that opportunity, they are very likely to accept it. So as I said, our work on campus at UCLA to make the healthy choice the easy choice, President Napolitano got wind of it and announced the UC Global Food Initiative July 1st, 2014. And here she is planting an oregano plant with our DIG undergrads who have a vegetable garden and fruit garden up on Sunset Rec in the northern part of UCLA. And basically, the UC Global Food Initiative is for all UC campuses. It's addressing one of the critical issues of our time, how to sustainably and nutritiously feed a world population expected to reach 8 billion by 2025. And currently, there are more than 20 working groups are underway developing best practices and toolkits to deploy across UC and share widely throughout California, the nation, and the world. And these work groups cover different focus areas. One's curricula, operations, service, research, and policy. And each UC campus, there are 10, have a number of different subgroups within these work groups. They're leading them. And then across the campuses make up the membership of these subgroups. Anyone can participate, and I welcome those that are listening, if you have an interest, to contact me, and we could see how you can get involved either on our campus or others depending on the work group. So our goal, basically, Jane and Terry Semel's vision was for us to have the healthiest campus in the country at UCLA, to make the healthy choice the easy choice, and then to have a ripple effect. And we've actually had a faster ripple effect than we expected. It is now, as you learned from the Global Food Initiative has extended to UC campuses, at least related to food and sustainability. And we also influenced the Partnership for Healthier America. They just announced last November a Healthier Campus Initiative, and over 25 universities have signed on across the country. So we're not just isolated to California now. We've helped support other activities across the country, and we're one of those universities. And Singapore and Turkey, representatives of universities from both those countries, have come to us to ask how they could start a global food initiative, and or a healthy campus initiative. And we're very open to sharing our lessons learned. This is an open book that we're sharing with all lessons learned, and hopefully we'll actually be having a book come out that will help support others to sort of have a roadmap to start their own healthy campus initiative in their own environment. Pardon me. So there's some emerging opportunities that we're looking at on our campus. One is food literacy. Another is capturing the personal enthusiasm about food to create a social movement. Not just food, though. We're also capturing the personal enthusiasm of mental health, emotional well-being, because all of this is mixed together related to outcomes that talk about healthy weight. We are big believers in making the healthy choice the easy choice, because if you have the default as the healthy choice, it takes less willpower, although willpower or choice is important. And as the McKenzie report mentions, all levels of intervention are needed at this time in order for us to curb what we're seeing as an emerging public health crisis, the obesity epidemic. And in that report, they mention that tobacco use is the #1 cost to society currently. The second is civil strife or war, and the third is obesity. So we really have to focus on promoting health and wellness through many different layers, and public health is certainly well positioned to do that. We also need to do multi-sector engagement, and that includes the food industry. We can't do it alone. We have to do it with policymakers. We have to do it with farmers, and we have to have government regulation. In particular, and I know that LA Department of Public Health is going to come out with a white paper about marketing to the preschool population unhealthy foods. We need to regulate that. It's a critical area to make a difference. And then, of course, environmental change strategies are critical. So here on campus, we're working to eat well, move well, breathe well, be well, mind well, all in conjunction with the main theme of living well. And that will lead us to a healthier outcome. Not that we're looking at weight as much as health. Health is the critical outcome that we're looking at. And we understand that we have to believe in the value and the strengths of individuals and communities. And I like to end this with Dalai Lama's quote, "With the realization of one's own potential and self-confidence in one's ability, one can build a better world." And then finally, my son, Samuel Bruce, when he was in 3rd grade, wrote this haiku, which I like to end with because it's so, he wrote it himself. I did not help him. "Fruit comes from flowers. Fruit is very good to eat. I like to eat fruit." So I thank you, and I'm open to questions.
Well, thank you very much, Dr. Slusser, for this great talk. By the way, fantastic haiku. I think.
Thanks.
Yeah, I think it hits on all levels, right? I wanted to ask you, I mean, you talked a little bit about emerging public health opportunities, and one of the things that caught my attention was multi-sector engagement. And I think what a lot of people think is, you know, the food industry or policymakers or people want to know, how do you actually get that kind of buy-in from people who might be looking more at the bottom line than actual overall health?
Yeah, so I'll identify a private sector group, not by name, but just by what they produce, which is yogurt. And I'd like to say that, you know, there are a lot of, you know, people are very interested in health and wellness. And if, you know, food whole food, food that has probably less steps to the origin to the person who eats it. There are a lot of suppliers that are there making money who are very interested in wanting and willing to partner with the groups like us who are promoting health and wellness. And it's to everyone's advantage. We can't do it alone. We don't have the resources in the public health or the medical arena. We need to partner with multiple groups. And, you know, this particular private sector group I've worked with to help support, you know, the dietary guideline sort of conversation, for instance, because there are areas in the dietary guidelines that are being rewritten as we speak, or I think the public commentary just ended, where we as a public can make a difference, but also these private sector groups can make a difference because they're going to respond to the drivers, which are the consumers. And the consumers, my reflection on consumers right now are the youth who, for instance, the number one thing that they take pictures of in Instagram are food images. And they're very interested in food. And I feel very confident that our emerging youth are our strength in what we can work on to help build our the health of our community and our population. And they're demanding healthier foods. So I feel that, you know, it's a win-win for everybody.
Well, actually, there was a question from Patrick who, and you kind of touched on this earlier. Can you discuss how economic and racial and other disparities might impact the My Plate and other dietary recommendations? And you had mentioned the pyramid that talked about socioeconomic, you know, factors being a huge factor.
Right.
And is there anything that you can talk a little bit more about that, you know, that some of your research has done, or some of the things that you've learned
Sure.
about that? Yeah.
Yeah. So so what I like to do when I approach a quandary or a challenge, I don't think of it as okay. So if you don't have very much, you live in a community where you don't have very much money or very much access to healthy food in certain situations, what are the strengths of that community? And one of the strengths, especially when you're raising children, we have a national treasure with the school and breakfast and dinner program in schools. Children who grow up in low-income communities or low-income households have access to free breakfast, lunch, and dinner and snack. And we have the Healthy Hunger-Free Kids Act that is being reauthorized this year. When it was originally authorized, it was some of the major tenets of it were increasing fruits and vegetables, increasing fruits, doubling the fruits at breakfast, doubling the fruits and vegetable offerings at lunch, increasing whole grains, decreasing sugar, decreasing salt. So the My Plate, if you look at a lunch program that you would be completely free, would be fit the My Plate paradigm. Now, what I've observed, and we all, you know, I think all of us know, people, the lunch program, the school lunch program, or any school food program suffers from an incredible PR problem. People just think of lunch at school to be disgusting. So I actually worked on a documentary to try to alter those attitudes, because if you do participate in those kinds of programs that are accessible to all and are funded, it's right now funded, that you will have 2 or 3 meals, if you choose to even have dinner at school, that are much more healthful than potentially what you might have at home. And my research that I took on early on in the late 90s in LA Unified found, even before that legislation, that children that were at Title I schools, so, you know, children that were in low-income communities, those children ate better at school than they did outside of school. And so it's a real I think that's a real way to access healthful food through, through the school, and it has a real opportunity. And it also has a great way to help reduce weight gain. If a child doesn't miss meals, in particular, if you go through your breakfast and lunch and you don't eat anything and you get out of school and you're ravenous, you're going to be much more susceptible to all those unhealthful foods that are unfortunately surrounding many of these neighborhoods where children go to school in these low-income communities. I hope that addressed some of the question.
Well, yeah. Well, here's another one, an interesting one. Dr. Slusser, what's your opinion about replacing cow's milk, at least for older children and adults, with items like soy milk, almond milk, etc.?
Well, if you think that cow's milk, most people ultimately, or over 50% of people will potentially get a lactose intolerance at some time in their lifetime in the world. So I think it's just a matter of whether you can manage the digestion of lactose. You could certainly stick with cow's milk. The main thing that in terms of drinking milk, period, is you really want to be sure children or adults get enough calcium. I think that's one of the biggest reasons to drink a milk product. But you can certainly get that calcium if it's soy milk or almond milk, as long as you get the kind that has calcium added to it. Or if you want to eat other foods that have calcium in it, that's also an option.
Okay. Just a reminder to all the folks joining us, if you have any questions, please feel free to type it into the chat window, and we'll address it during this this Q&A section. I did have another question for you, Dr. Slusser. You talked about changing context, and obviously that's a huge part of making the healthy choice, the right choice, the healthy choice. And you mentioned two things: active transport and price promotions, and I was wondering what exactly those are, and if you could go into that a little bit.
Sure. Well, so we'll start with active transport, and for all my Be Well colleagues who might be on this webinar, they're working very actively here on campus to promote active transport that would include walking, biking, taking the bus, and maybe getting out a few blocks before you need to, so you walk those extra steps. And if you're wheelchair bound, there are ways of also being active by getting out maybe of your car or the bus a block or two earlier, and then you can be active by wheeling yourself into campus or wherever you might be. So that also includes taking stairs if you can, and other forms of movement. So you're integrating basically your physical activity into your daily activity, and that creates opportunities for movement that might not seem as sort of prescriptive, or some people always say, well, I don't have the time or the willpower for exercise. Well, exercise doesn't even have to be quote unquote exercise. It could just be movement, and that is what active transport includes. The other question that you had was about price influencing behavior, and I think the perfect example was the one I showed or described related to our vending machines on campus, which is called behavioral economics. And we've also done it in our hospital setting, where in our cafeteria, we've reduced the price at the salad bar and increased the price of soda that are served in the cafeteria. And that's been able to actually increase substantially the number of people who participate in the salad bar, and also the cafeteria has not lost money because they were able to subsidize basically the salad bar with the increased prices of the soda. So that's another example. Basically, you can influence behavior based on the price point. That's
actually really interesting. one of the things that, and I pardon because I kind of come from a layperson perspective, and so I apologize to all the experts that are listening in here. But when I listen to what you've talked about, I really get a sense of, you're also trying to make this fun, right? Like you kind of mentioned the communication that you want. There's the old saying that what is it? Like basically you have to work hard. Like if what is it? Shoot, I can't remember. But it's about exercise, right? Like you have to put a lot of no pain, no gain. I think is what it is, right? And it seems like a lot of what you're pushing for is to let people know, no, it doesn't have to be painful in order to see the gains that you're looking for.
That's right.
Would you say that?
Yeah. Oh yeah. So, I feel that if you make something, it was really interesting. We had a Healthy Campus Initiative Symposium last week, about 10 days ago, and we had Sam Cass, who's the former personal White House chef for Michelle and Barack Obama, and also the former White House pastry chef, and on a panel. And Sam said, look, if you make things which are what the soda industry does, where you make things and you associate it with love and happiness and freedom, and then you try to promote healthful food with, you gotta, stick with the diet, and who's gonna win? You gotta change. We have to change our messaging. We gotta capture the spirit of what I'm seeing the under 30-year-old crowd doing, which are taking pictures of beautiful food that looks absolutely delicious, makes me hungry, and makes me want to eat it because it's so enticing, and also you want to make your activity social and fun, and if you can do something like that and change the perception of health, you can go a long way. Great. I suggest everyone go on YouTube and look at Michael Moss's 8-minute video of how he worked with this sort of well-known ad agency in New York to figure out how do you market broccoli. And they basically worked out a competition between broccoli and kale. And they made a broccoli advertisement that showed, this sort of competition between broccoli and kale, and it's fabulous. Now remember, that's a social marketing message. That's going to be higher up on that health impact pyramid. We need it. We need that piece. But remember, that's not going to give you the biggest bang for the buck. The biggest bang for the buck is if we had, I guess, in an ideal world, we had broccoli growing in front of everybody's apartment pad, or on their windowsills, and they just walked by and picked a piece to eat, of a little broccoli flower. That would make the easy choice, the healthy choice, the easy choice. But I think you're right. We've got to rethink and reframe how we're talking about the healthy lifestyle, and we have to learn from the pros, who are certainly people like ad agencies and communication people. That's why I worked on this documentary about the school lunch program. It's called Our Food Chain. Nonprofit produced it basically to reframe the message of the school lunch program, and communication through media is much more effective than I find much more effective, and tells the story much faster than any other means. We ran a series of focus groups with a 6-minute clip of this documentary, and the kind of conversation that I had with parents prior to watching the 6-minute clip in Boyle Heights compared to after was completely different. In the beginning, they were talking about, oh, the food is not healthy for children, it doesn't look good, and then after they watched the 6-minute clip, they were talking about how, it's our turn. We need to be promoting this at home. I didn't, know that they were doing this at school, and so within 6 minutes, it was a changed conversation. Shows the power of communication, image, visualization, and how you can make something accessible to people in a way that hopefully can change attitudes and then change behavior after that.
Well, Dr. Slusser, there is a question from the audience. Hi, Dr. Slusser. There have been many attempts on a policy level to curb the rise of obesity, posting calorie info, fast food ban, soda tax. There was a recent article in the LA Times about how the fast food ban in South LA didn't work. Obesity rates have increased in the area since the ban was implemented. What are your thoughts on some of these measures?
Right. Well, so some of that exactly is what I was referring to is, in a way, when you ban things. So our approach to our vending machine, for instance, on campus was we didn't ban the unhealthy food. What we did was we created this default where people didn't even realize what they were choosing in terms of health versus healthful, although we did indicate what we considered to be healthier items with a little sticker, but we didn't say healthy item, we said healthy campus initiative pick. And we did that on purpose. We did it because we didn't want to make people be feeling like we were, sort of that reverse psychology where, oh, I don't want to eat, I'm going for a snack, I don't need health. Or the other part was, how healthy can food be in a vending machine? That was the other part. Joe Vienna, who is the grad student who did the research, said it was almost like a needle exchange program in a vending machine. We were just trying to minimize risk. But the point is that, you don't want to make things forbidden. You want to create the default to be healthful. And the default can be done very subliminally, like creating price differentials or creating that, they did a wonderful study in Mass General where they did what you call choice architecture, where you moved the water to the checkout stand so that would be the thing you would grab versus the chocolate bar or whatever else, or the energy drink that often at convenience stores you see at the checkout stand. So there's ways of influencing behavior that don't create this sort of forbidden food and also don't create a situation where people feel like they're being penalized. Like soda taxes have a place potentially, but they're not necessarily in that pyramid going to necessarily make a huge difference. But it can, again, I think we don't know enough about the outcomes of this, and we need to understand how we can try new and different interventions to make a difference. Since we know some of these outcomes, like what we saw in South LA, this sort of the fast food ban actually not working, that's important for us to know. And we need to know what then we should do. And I again get back to this more positive approach by making things more fun and more interesting and not making people feel deprived.
By the way, I found the New York Times broccoli makeover video. I'll post the link for you guys there in case you want to look at that. Well, thank you very much. We do still have a few minutes, so if you want to get in your questions, please get them in now. We'll try to get Dr. Slusser to answer them as quickly as possible. One of the questions.
I think I saw one.
Oh,
sorry to interrupt. I think I saw one about the parent.
Oh, you're right. I'm sorry.
And public health. Yeah. So I don't know what the exact question was, but I wanted to.
It's you mentioned a parenting You mentioned a parenting toolkit that will be available in June. How will we be able to access this toolkit through LA County Department of Public Health website, or through UCLA, or perhaps somewhere else?
Yeah. Yes. So the LA Department of Public Health, the county is going to have it on their website, so it will have a downloadable version to it. And currently we're going to be doing training for 20 sites around LA that have gotten one of their funding grants from the LA County Department of Public Health, their first 5 LA grants. And we're going to be doing the training for their providers that are going to be delivering this class to them, to their community members in June. And so I know they have a few slots for people to observe these trainings, so if people are interested, let me know and I can see if we can advocate for you to be part of them. They're going to be an all-day training, I think the week of June 22nd. And every day of the week, I believe, except Wednesday. And the real focus of these trainings is not just the content of the classes, but the methodology, because the real strength of this particular intervention was what my colleague Dr. Fred Frankel brought in, which was the parenting component based on social learning. And so that methodology is critical, with assignments for parents to go home and try out different parenting techniques and different nutrition and physical activity and sleep-like behavior changes. And then they come back to the group after 1 week of trying it and report back to the group and get ideas of what they could have done better, or maybe they did well and they could give advice to one of their other colleagues that are in the group that could help support them in their own context. And that's the strength of that kind of training. It's not a didactic session. It's really more experiential, with obviously a focus on particular information to be achieved during each 1.5-hour classes. So highly recommend it. It was we also published that data in 2 different journal articles that you can look up if you want on PubMed.
That's interesting. Was there anything in there? I mean, you obviously there's the 5-2-1-0 blast off methodology. Was there anything else from there that that parents can take away? Certain parenting skills or techniques that seem to be very effective.
Yes, well, according to Fred Frankel, the most effective parenting skill are routines, and setting routines during the course of the day. So those are also among the hardest, if you can imagine, right? How do you get your child into bed and asleep at a reasonable hour so they get the 10 hours of sleep that they're really supposed to get, and if they're younger, that extra nap in the afternoon, along with the fact that you need to get them up early enough to get them to have a healthful breakfast if they're going to leave the house, and so forth. So setting routines is critical, and we work very strong, very at length with the families to sort of set them in motion so that they can start working on it. And in our study, we found, it was a randomized control study, we found that the parents that were participating in the intervention really spoke to the fact that not only did the routines help them with their kids, but they also felt less stress in their own lives because they didn't have this sort of sense of sort of hurriedness that you get, when you leave the house, when you get up too late to even tie your shoes and things like that. So there was a real sense of pace that pace and peace that they felt as they instituted these kinds of routines, especially because, of course, the kids, their sleep patterns then influence their behaviors as well. The data shows nationally that sleep and family meals and less inactive time are the 3 sort of drivers or risk factors, especially among high-risk groups in childhood in terms of obesity. So those are clearly 3 areas that parents and parenting play big parts in.
Well, consider this the last call for questions. If there are none, I'm going to start wrapping things up since we're getting so close to 1 o'clock. We are running out of time, but in the meantime, thank you everybody for joining us today. Thank you, Dr. Slusser, for this really interesting conversation and for really promoting just healthy living for all, not just for the children, but for adults as well. And thank you to everyone for joining us for the webinars, all of them that we've had this year, and for this one, which is our final one of the school year. If you've missed any of our previous webinars, just go to the School of Public Health website. website, ph.ucla.edu. Sorry, ph.ucla.edu. They are all archived there, and you can please allow a few days for this one to post. ph.ucla.edu is also where you can go to find out about future webinars, which will be posted on our website as we confirm the dates and topics. And you can also, again, please watch your email in the fall, which will announce our webinar schedule for that. If you have any ideas for future webinar topics, or you want to be added to our mailing list, feel free to contact us at publichealth@support.ucla.edu. And again, by the way, Dr. Slusser, before we say goodbye, I have definitely fallen victim to the vending machine eye level technique. I've looked at it, and I looked down and I said, nope, I think I am going to get that, the lighter snack as a result.
Awesome. That's great to hear. Thank you.
So thank you again for joining us, and again, thank you everybody else.
Okay.